Welcome back. This is Dr. Eric Roden, physical therapist at Neurology Solutions. We're going to go through a seated, basically lower extremity or leg stretching. Now, we have some limitations just because we are in a seated position, but that doesn't mean that you shouldn't be stretching, especially if you're in a wheelchair. It is critical that we're moving these legs whenever we can. You have a higher risk for contractures, basically limitations or range of motion changes in those muscles if you do not stretch them and move them. So just follow along. These are easy. These can be done in an office if you're still working. So let's get started. So the first one is going to be basically for our hip rotators. This is going to be a piriformis stretch, or basically kind of this whole glute area, these rotators. So as tolerated, you're going to try to bring this leg up. You might need to help it a little bit. We're going to bring it over, and that ankle is going to lay right on top of that other knee. Now I'm not putting a lot of pressure here or anything. I'm just kind of gently putting my hand here. Now there's two variations that we're going to do. One, we're actually going to round that back and we're going to just try to fold in half. I'm trying to bring that chest as far as I can towards that other leg. And I might feel a little bit in my spine, and we're going to hold this position. Get those nice deep breaths. I'm feeling a lot of stretch in my hip right here, so definitely kind of as tolerated. Again, this should not be painful. If you're feeling any pain or kind of tension in the knee, you might be pushing a little hard here, so make sure it is supported. We should be feeling all this in our hip. All right, we're going to come out of there nice and easy. We're going to switch sides. Now, I'm a little tighter on my left. Here's a soccer only kicking with one leg. You definitely will have most likely a tighter side. You may not even be able to get here. Maybe you're way up here. That's okay. Just do what you can. And again, we're going to fold in half here. And breathe. Everything's through the belly. I'm relaxing my head. Every exhale, I'm thinking my body's going to try to go a little deeper, get a little better stretch. Excellent. We're going to come back out of there. So our second variation, our second round, we're going to come back. Now this time, instead of rounding the back, I want you to keep nice and tall, as big as you can. And I want you to think about your hip joints tilting forward. So keeping nice and tall, I'm only going to bend a little bit, and I already feel a killer stretch in that hip. So notice I'm not folding down anymore. My spine is in a nice neutral position still. I'm getting that nice tension there, breathing. Good, we're going to switch sides. Here we go. And bringing that leg up. Again, you should be feeling this only in the hip. If you're feeling anything in the knees, check your form, make sure you're doing it correctly. Again, I'm going to be big and tall. And we're going to fold, and ooh, this left side is a lot tighter. So we're going to breathe. If you are feeling maybe a little tighter side, maybe you hold on that side a little longer compared to the other one. But make sure you are doing both sides. Even if you only have one problem side, you need to be able to give the other side equal attention. It gets jealous sometimes, so make sure you do both. Excellent. So we're going to come out of there. Really important, especially if you're in a wheelchair. Those kind of sling seats, they love to kick these legs into internal rotation. This is kind of a problem. We need to be able to have that external rotation, be able to line up our knees. All right, our next one we're going to do is basically going to be a calf stretch. Now these are a little challenging when you're sitting, but if you do have really tight calves, you can get a stretch in a seated position. You're going to pull this leg back as far as you can, keeping the heel on the floor, okay? You're going to get right to that point where you feel like your heel's about to come off. Stay there. You're going to put both hands on top of your knee and apply pressure downwards. And I actually do feel a little bit of a stretch in my Achilles here. And we're going to breathe. You might even feel stretch in your knee, maybe if you've had a total knee or if you've got some scar tissue or prior injury. It's actually a good knee flexion stretch too if you're limited. And we're going to switch sides. Good. Come out of there. Bring that again as far back, and you also want it straight. A lot of people have that turnout. Try to make it right underneath that knee, toes pointing forward, and apply that pressure downward. So I'm applying kind of at an angle, so down and forward, causing that shin bone or your tibia to actually advance a little forward, which again increases that stretch. And we're breathing. That was a big chest breath. That's what you should not do. We should be breathing from the tummy. Excellent. Let's switch back. Get that nice stretch there, feel there, and apply the pressure. Now this is our knee is bent, so we're actually biasing one of the two kind of main calf muscles there. I'll explain that in a second. We can try to do another variation. Good. Let's come back out of there. Let's do our left leg again. And if you're not feeling it as much this time, move it back a little further. And again, apply that pressure and see if you do. It should be an active stretch the whole time. We should be feeling some type of tension the entire time. Excellent. All right, so the second variation, again, you have two calf muscles, your soleus and your gastrocnemius, okay? They insert in slightly different points. So when your knee is straight versus your knee is bent, that does bias a particular muscle. So this you'd utilize probably a towel, even a belt. Sometimes those stretchy bands, they can work. I'm gonna grab one real quick and I'll demonstrate how that looks, okay? So I'm going to use a stretch strap. I prefer normally a firmer, either a stretching actual strap. You can buy those on Amazon versus a TheraBand. You're not going to get quite as much pull, but still can be effective. So my leg and my knee are going to try to be straight. I'm going to hook the band underneath my basically ball of the foot, and I'm going to pull back, getting a good stretch. And I'm probably going to feel this a little higher compared to the last one. Now you want to make sure the stretchy bands, they're not too high, otherwise they're going to fling and hit you in the face, so be careful. And we're getting a nice stretch there. If you do have a thick TheraBand, that can actually help with the stretch and doesn't make your arms quite as tired. And we're breathing, good. And let's switch sides. So a belt's nice too, because you can kind of hook the belt around it, make a loop, and then you can just pull with those arms and get a really good stretch in the calf. Okay, that last one where we had the knee bent, I felt that a little lower in my Achilles, closer to my heel. This one I feel a little higher, more in the beef of the calf muscle and behind the knee. And I might even actively try to pull my toes up even further during this drill. Good? And let's switch back. Again, try to keep that knee straight and bending that ankle as much as possible. Really important to have proper ankle mobility. That really affects your walking, your ability to navigate stairs if you do not have proper dorsiflexion, which is bending of the ankle. And make sure to breathe. All right, last one. Straight, here we go. Great. If you need breaks, go ahead. But again, this is a stretch series. It should be pretty gentle. They should not be painful. Excellent. All right, we're going to move on to those nasty hamstrings that like to tighten up on us in the back of the leg. So there's 3 variations that we're going to do. We're only going to do 1 series on each side because we are stretching the hamstrings the entire time, but we are biasing the middle, the lateral, and the medial sets, okay? So directly in the hamstring, your adductor set, which is kind of the groin region, and then these lateral ones, maybe a little bit of TFL, but mostly lateral hamstring. So let's start with just straight forward. One knee's gonna stay bent, the other one's gonna go straight out, just like that last stretch. Again, just like the first piriformis stretch, we have 2 variations. One where we're actually gonna fold down all the way, and I'm going to bend my back, and we're going to get this nice stretch. Now I also feel a big stretch in my low back, but I also still feel it on the hamstring too. If you're feeling excessive tension, release the foot, and that might actually help you get a little bit more of a stretch because you can have nerve tension if this ankle is bent up too much. And we're going to breathe and breathe. Good, we're going to come back up nice and easy. We're going to switch sides. And we're going to fall all the way down, letting that back release, let the head release. Foot's relaxed, getting that nice stretch all the way through the hamstring and even into the low back. That complex, they like to talk to each other and they coordinate movement together, so it's important to stretch them both. Good, let's come back up. We're going to do one more time each side. This variation though, we're going to keep tall just like we did with the piriformis one, and we're going to tip those hips forward. So up tall, tip forward, and whoo, I already feel that. Notice I'm not even touching my toes this time. So I'm very much isolating the hamstring with this version, versus when I bend, I can kind of cheat with my low back. So this says, Eric, you got some tight hamstrings. I probably need to work on these a little more. Okay? Notice my toe is still up and down. Very important. You don't want that rotating out or to the inside. That's going to be a different stretch altogether. And let's come back out. And back down. Again, up tall, tip those hips forward, get that killer stretch in the back of the leg. If you're feeling a lot in the calf, release the foot a little, and you want to feel that more in the hamstring. And we're breathing. Excellent. All right, we're going to move now to more the groin, these adductors, as well as the medial hamstring. So we're going to bring that leg straight out again, except now we're going to move it to the side as tolerated. You got to be pretty far forward in the chair. If you're really far back, you can't do much with it. So make sure you get to that edge of the chair as long as you feel safe. We're going to bring that foot out to the side. Just like the last one, we're going to do two variations. We're going to fall straight down, just like the last one, but the leg is out to the side and is going to bias these muscles here. So here we go. We're going to fall down, trying to touch the floor if we can. And I'm getting a nice stretch in the groin as well as my low back. And we're breathing. One more breath. Good. Come out of there nice and slow. If your back does have any pain, you can also help yourself up with that other side or come back up on your own. Let's bring that one in. We're going to bring the other one out to the side. Now again, as tolerated, you can go even wider if you don't feel much. And we're going to dive down again, rounding that back, going as far as we can, relaxing the spine. Again, no pain. You should just feel a nice stretch in that internal kind of groin hamstring area. Excellent. We're going to come back up. We're going to go back to that right leg, just like the last one. Variation 2, tall, tall posture. Tip those hips forward. And I'm reaching out a little further this time, because if I just go down, I'm going to want to round my back. And I get a very different stretch. Still biasing towards this inside, but it's very different than the last one. And we're breathing. Last one. Good, come back out. Excellent, let's move to the last side on the left. Here we go, get our setup nice and stable. Tall, tip those hips, and we're breathing, good. Excellent. All right, the last of those hamstring is going to be the lateral one. Sometimes this kind of messes with the balance a little bit, so be careful. If you got arm rest, that can help sometimes. Same setup, but instead of going out, we're going to go in. So we're going to go across the body. Now you may not have much. Maybe you only go to here. That's okay. I'm going to go as far as I feel comfortable. So right in front of my other foot. If you'll notice midline, right, it just passes it. It's going to bias that lateral set of hamstring. Here we go. We're going to come down just like the first series. We're going to fold, again, straight forward, and whoo, I feel a killer stretch on that outside there. This tends to be the more common tight point in most people. So if you're feeling a lot more than the last one, that is very normal. I'm going to relax that head like it should be. And we're going to come out of there, switch sides, forward, bring it over, and fall forward straight down. Again, killer stretch on that outside area. If you feel like you're going to fall, you can have a little kind of tripod effect here. Last breath. Good, and come back up. All right, last one of this series. Here we go. We're going to come across again. Big and tall. Tip those hips forward. Woo! And hello, there it is. Definitely feeling this version compared to the last one. My low back is hypermobile, so it likes to cheat a little bit. Our bodies will go in the path of least resistance. So if you are not feeling a stretch on this, you might be doing something wrong. So adjust, modify until you feel that stretch. And again, no pain, just discomfort of a stretch. Excellent. Let's come back, forward and over, up tall, tip those hips and reach. Doing great. This is the last one. We're breathing. Excellent. All right, so that is a seated lower extremity stretching series. Thank you for joining us. We look forward to seeing you again, and keep following our videos. Take care.